Good afternoon, and welcome. I'd like to welcome everybody to our October 2011 Public Health Practice Grand Rounds. On behalf of the Mid-Atlantic Public Health Training Center here at the Johns Hopkins Bloomberg School of Public Health and the Maryland Department of Health and Mental Hygiene, I'd like to welcome you. My name's Molly Mitchell, and I'm the coordinator of the Mid-Atlantic Public Health Training Center. And our presentation today is on the new cigarette warning labels, the FDA's bold move and its expected impact on public health. And before we get started with today's presentation, I would just like to draw the attention for those of you who are watching online. Please ask you to sign in so that we can tell our federal funders a little bit more about who is watching today, and also ask you to fill out the evaluation when you're done. And also want to draw your attention to some of our other public health practice grand rounds that are archived on our website, and welcome you to view those as well. And also draw your attention to some of our other upcoming trainings, which include team building and grant writing, and our next month's grand rounds, which will be on suicide prevention. So with that, I think I'll go ahead and introduce our presenters for today. We have Matthew Myers, who is the president of the Campaign for Tobacco-Free Kids, a privately funded organization established to reduce tobacco use and its devastating consequences in the United States and around the world. Over the past 25 years, Mr. Myers has participated in virtually every major national tobacco-related legislation effort and has worked with state tobacco prevention advocates and officials around the country. In 1999, Mr. Myers was asked to serve on the first advisory committee established to advise the Director General of the World Health Organization on tobacco issues. The following year, Mr. Myers was named by President Clinton to co-chair a presidential commission to examine the economic problems being experienced by tobacco farmers and their communities and recommend possible solutions. In October 2004, the Harvard School of Public Health bestowed its highest honor, the prestigious Julius B. Richmond Award, on Mr. Myers for his work as an advocate in preventing tobacco industry marketing to children. In October 2007, the American Cancer Society bestowed its highest award, the Medal of Honor for Cancer Control, on Mr. Myers for his relentless work to eliminate tobacco use. Our second presenter today is Dr. Joanna Cohen, who is the Bloomberg Associate Professor of Disease Prevention and the Director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. She has been involved in tobacco policy research for almost 20 years. Trained in epidemiology and health policy, Dr. Cohen's research interests focus on the factors that affect the adoption and implementation of public health policies, and on evaluating the beneficial effects and the unintended consequences of such policies. She has worked on studies of both Canadian and U.S. legislators regarding tobacco and tobacco control policy, a longitudinal cohort of smokers focusing on factors influencing quitting behavior, tobacco promotion at the point of sale, tobacco prices including taxes, tobacco packaging, options for reducing the physical availability of tobacco products, and tobacco industry interference in tobacco control. She is the senior editor of the international journal Tobacco Control. With that, I will hand the floor over to Mr. Myers.
Thank you, and it's a delight to be here this afternoon. I very much appreciate the opportunity because I believe within the United States we really are at an historic juncture with regard to tobacco control, and warning labels are a core part of the changes that we hope to see in the near future. So why are we here today, and where do warning labels fit into the entire picture? Dr. Cohen and I have somewhat divided up how we're going to talk about this so we don't overlap. My organization played a central role in the enactment of the legislation which gave the FDA the authority to adopt the new warning labels that we're going to talk about today. I want to talk a little bit about the intersection of politics and public health policy and what it means for what we're about to do. Let me put the new warning labels in a bit of context for you. And that is, prior to June 22nd, 2009, in the United States, there was no federal agency, no governmental agency whatsoever with any authority over the content of tobacco products, over the ingredients that went into tobacco products, over what tobacco companies had to tell the American public about what was in tobacco products, over what the tobacco companies had to tell the American public about what it knew about the harm of its products, over the labeling of cigarette products, over the marketing of cigarette products, over health claims made for cigarette products, and only Congress had the authority to make any changes to the content, format, or substance of the warning labels on cigarette products. As a direct result, if you picked up two different products made by the Philip Morris companies, one Kraft macaroni and cheese, and the second Marlboro cigarettes, you would see in the label of Kraft macaroni and cheese a list of every ingredient. You would see no such thing on Marlboro. Every ingredient in Kraft macaroni and cheese had to be tested for safety. Not true for Marlboro. So the product that killed 1 out of 2 long-term users was totally exempt from all government regulation and carried a warning label on its side that was virtually impossible to read. So where's the history in this, and how does it fit with where we are today? In 1964, the Surgeon General of the United States issued a report with a blue ribbon panel that found conclusively that smoking was directly related in a cause of cancer and other serious diseases. The Federal Trade Commission moved immediately to require quite strong health warnings on cigarette packages. Within days, the Congress stepped in and put a stop to that. A Congress where you found members from tobacco-growing states sitting on virtually every critical committee. So what we found in 1964 was a Congress at a time where there was need for strong action, instead put the first American health warnings and some of the first world health warnings on cigarettes on the side of the package so that it didn't interfere with the display, simply saying cigarette smoking may be harmful to your health. Note it says may, despite the fact that Surgeon General said there was no doubt whatsoever. 4 years later, under pressure because of TV advertising and the impact of TV advertising on kids, Congress revised that health warning, boldly revised it. It changed the may to is, left it in the same text size, in the same place on the package, and blithely moved forward. It was 12 years before another federal agency dared move into this arena. And that was 1981 when the Federal Trade Commission decided it would boldly go again, but this time all it would do was make a recommendation to Congress. It conducted a lengthy study that found that the current health warnings were ineffective, that the tobacco industry had succeeded in literally undermining the entire message with their packaging and marketing, and therefore recommended to Congress that Congress should revise the warning labels. I should tell you that there was one member of the Federal Trade Commission, a little-known story, who had been a member of the Federal Trade Commission in 1964, who said, under no condition will I ever vote again to strengthen warning labels on cigarette packages. I've been there, done that. I understand the political consequences of that. And if the rest of you are so stupid as to wanting to do it, that's fine, go ahead. But count me out. It took 3 years after that report for Congress to revise the warning labels. Again, this time it did put stronger warning labels on, 4 of them rotating. It had learned to do that. But text only, still on the side of the package. Extraordinary negotiation over the size of the font, if one can believe that, given that you're only working with about half of the side of a cigarette pack. And a little-known story, which was the one thing Congress refused to do, was to include a warning label at that time that cigarettes were addictive. Fast forward to this. Congress does nothing year after year after year. No federal agency has any authority, and no state had any authority to change labeling on it. 1996, the then Commissioner of the Food and Drug Administration, David Kessler, decided that for the first time in history, his agency was going to look into whether it had regulatory authority over tobacco, based on the notion that the tobacco industry manipulation of nicotine made cigarettes a drug delivery device. Note, Dr. Kessler could do nothing about cigarette warnings on those packages, even after he asserted jurisdiction, because only Congress had the authority to do that. However, 4 years later, after substantial litigation, the Supreme Court of the United States told the Food and Drug Administration that only Congress had the authority to decide who was going to regulate tobacco products, and Congress, by its silence, had obviously decided it shouldn't be the FDA. That began what was, in fact, a 15-year effort to get Congress to give away the authority over the micromanagement of cigarette products. 1998, comprehensive legislation was introduced in the United States Senate with what we thought was very broad support. For those of you who watch the filibuster rules today, you would appreciate that after a month of debate on the floor of the United States Senate, a bill that would have given FDA authority, would have given FDA the authority as well to change warning labels, fell 3 votes short and died a painful death for those of us who worked on it. 3 years later, Ted Kennedy said, we're going to revive this, we're going to make this happen, introduce new legislation with bipartisan support. It went nowhere. In part as a result of the presidential commission that Molly mentioned, an agreement was struck between tobacco growers and leading public health advocates that we would support helping get them out of tobacco growing if they would support legislation giving FDA jurisdiction over tobacco. And they did, to their extraordinary credit. Republican leadership blocked it. 3 years later, Kennedy reintroduced the bill again. This time it passed the U.S. Senate twice, but the House refused to take it up. 3 years later, Kennedy again reintroduced it, this time with a new co-sponsor, pushed it forward. Again, he got it through his committee, but then the Republicans succeeded in blocking it. We succeeded in passing it the next year twice in the House of Representatives, but couldn't get it through the Senate. Finally, in 2009, after what can only be described as a Herculean effort, the Congress of the United States finally passed a comprehensive piece of legislation that gave FDA authority over the manufacturing, marketing, sale, distribution of cigarettes and smokeless and all other tobacco products, including the authority to revise the warning labels and take the authority of warning labels out of the hands of Congress. It's important, I think, for public health practitioners to understand how very much certain issues involving public health, and certainly tobacco, really do involve an intersection of public policy, public advocacy, and science. Why did we finally succeed? I think there are a couple of reasons, and I think it's very important to understand them, because as we look at the public health debates going forward, not just on tobacco, but other issues. First, public health leaders realized the importance of framing the issue. For years, this had been government regulation, a nanny state, government telling people what to do, all of the things you hear about so many issues here. Public health leaders here recognized that and adopted 3 themes for this legislation. One was that tobacco use was in fact a pediatric disease. This was about protecting our kids. This was about an industry preying on our children. 2, that you needed to look at how the tobacco industry itself had behaved, that only with government regulation could you protect our children. The long litany of the tobacco industry's lies, deceptions, and marketing to kids. And 3, that it was really tobacco industry money and special interest politics that were getting in the way of protecting the American public. As you'll see, those 3 things were ultimately critical to its success, because this legislation, which is perhaps the greatest expansion of government regulatory authority in the last 10 years, passed with bipartisan support. It required painstaking grassroots work. By the time the legislation passed, over 1,000 organizations around the country supported the legislation. They were Republican, Democrat, they were liberal, they were conservative. They ran across the religious spectrum, and critically ran across the religious spectrum. There was no way to tag this as a Democrat bill, a liberal bill, or an anti-bill. People did work back home so that we proved that, in fact, this bill protecting America's children better informing the American public was widely popular. It was widely popular in every region of the country. It was widely popular with every political demographic. No matter how conservative, no matter how Republican a state, we had data to show that, in fact, the American people wanted this to happen. Now, why aren't we just talking about a bill that deals with warning labels? I think the answer to that is very, very important. Warning labels are an incredible tool as part of the overall battle to reduce tobacco use. But there is no such thing as a magic bullet. There is no such thing as if we just do this one thing, we will solve this problem. And that is a fundamental premise of the legislation, and it has to be a fundamental premise of any issue that one works on if you really want to reduce the death and disease of tobacco control. So this legislation takes a comprehensive approach, of which the new warning labels are a component. And it has a number of critical factors. I just want to tick them off because you need to see where the warning labels fit to understand why we believe they will have such a dramatic effect. First, for the first time in history, it means we have a government agency that has the power to get information from the tobacco industry and to make that information public so that consumers, researchers can digest it, understand it, and prevent the industry from continuing to keep critical secrets. Second, for the first time in history, it gives a government agency authority over how tobacco industry products are marketed to the extent permitted by the First Amendment in order to protect the public health. Third, it provides a national solution to the whole problem of youth tobacco use. Fourth, it takes a comprehensive approach to how we inform consumers. The warning labels are only a single part of it. The second piece that relates to it is preventing the tobacco industry from undermining that information, from preventing the tobacco industry from making claims that mislead the American public, and from preventing the tobacco industry from using various forms of tests that mislead the American public, and I'll talk about that. Fifth, it regulates the content of tobacco products. It's an area that we have never looked at before, but it is the secret underbelly of tobacco control. We can do all the things we want, but one of the things we've learned, and I'll talk about this briefly, is if the industry controls the product and we know nothing about it, they can undermine it by manipulating the product itself. And then lastly, it reflects the view that the states have been the engine of new innovation. And therefore, although this gives the federal government very new, very broad authority, it goes out of its way to expand the authority of state officials. So let me just tick off some of these so you put them in the context of the warning labels. First, why do we need more information? Don't we know that smoking causes disease? There's a lot of things that we don't know about what the tobacco industry does. Here's a study that came out of Harvard in 2006 that shows that while tar levels of cigarettes have been going down for years, and the industry has claimed that nicotine tracks tar levels down. In fact, when you carefully measure over time, the nicotine levels, the thing that causes addiction in cigarettes, in fact, while tar levels were going down because of the manipulation of the tobacco industry, nicotine levels were actually going up. What does that mean? Potentially, it means that people are getting addicted more quickly, that they're getting addicted more severely, and that it means that the public health efforts to reduce the number of people who start and increase the number of people who stop need to take into account those changes. Most importantly, it means we should have been able to stop it, not 20 years after it started, but just when the industry wanted to do it. So the disclosure to the FDA for the first time now require the tobacco companies to tell the FDA what they're doing with their product before they do it. They're requiring them to conduct studies about what they do to their product before FDA allows the product on the market. That means in the hands of an aggressive FDA, what happened over the last 25 years with nicotine should never be able to happen again. Equally as important, it gives FDA the authority to tell us, the American public, our children, researchers, what's going on. Why do we need to restrict tobacco marketing? After all, I would wager that most of the people in this room probably no longer see a great deal of tobacco marketing given the progress we've made. Well, I think if that's what you believe, you need to go into a convenience store. or you need to go look at where cigarettes are displayed, or you need to go on the internet and go to a whole host of places. The need to restrict tobacco marketing is a core reflection of the fact that the tobacco industry doesn't sell a product. It sells an image. The Marlboro cigarette isn't the bestseller among young people, male and female, because it tastes better. The Marlboro cigarette is the bestseller among young people in many countries because of the image that the Marlboro man has projected around there. If we're going to truly break the link between smoking and the transition to being a young adolescent, we've got to do it quickly. So, for the first time, this not only contains specific restrictions on tobacco marketing, it gives the FDA the authority to adjust to new marketing tactics by the tobacco industry. And just this last week, the FDA let a contract that will, for the first time, provide researchers the funding to really track what the tobacco industry is doing. Let's talk about the regulation of the product. Why is that relevant to warning labels? I already gave you the nicotine example. Let me give you a better example. If I asked everybody in this room today whether cigarettes are more or less dangerous today than they are when the Surgeon General issued his first report in 1964, I bet everybody here would say less dangerous. They're lower tar, they don't give off the same smell in many cases. In fact, researchers have shown in a study that I think is truly astounding that for a smoker today in the United States, the risk of lung cancer is almost twice that of what it was in 1964. Think about that for a second. Those sleek cigarettes, those lower tar cigarettes that everyone assumes has reduced the risk of disease, in fact, research has shown, probably because of the rise of nitrosamine levels, because of how they've lowered tar levels on tar tests, actually, today's consumer is at greater risk in the United States than they were in 1964. Interestingly as well, one of the ways that they were able to reach these conclusions is they looked at other countries with cigarettes that have not been as manipulated as ours and found that that's not true globally. In Australia, the risk of lung cancer, in fact, hasn't gone up, so that they have seen a greater decline than we have. That could happen only because there was no federal agency with any authority to regulate nitrosamine levels or the levels of other carcinogens. So even as tar levels were going down, we have only recently discovered that critical other components of the cigarettes were going up. This would allow FDA to tackle that and to tackle it effectively. Why do we need to separately regulate health claims if we're going to have these very strong warning labels on there? Well, I think the answer is the tobacco industry has demonstrated its ability to undermine warnings. I don't care how graphic they are. You know, for those of you who are over 50, you'll remember the old True ads that were low tar ads saying, considering all I'd heard, I'd decide to either quit or smoke. True is evidence that there really was a safe way to do this. Much more recently, in the last 10 years, we've seen a host of much more sophisticated ads. Omni cigarettes, a cigarette that bombed. Fortunately, it tasted bad. Talked about reduced carcinogens, premium taste. Another ad talks about that they've eliminated the 4 major causes of lung cancer in cigarettes, which is really interesting since the National Cancer Institute couldn't tell you what the 4 major causes of lung cancer in cigarettes were. No evidence, but nothing to prevent the claims. That can't happen today. And that's critically important, that FDA has the authority to prevent those claims before they're made. A claim made that hasn't gone through FDA is illegal from the very get-go, and it can, with a rigorous FDA, bring about fundamental changes. So why, with all these changes, did we need stronger warning labels? There's the fundamental question. Why was that a critical component of the legislation? I think there's a pretty straightforward answer. We're dealing with an industry that has behaved in a way that is more unscrupulous over a longer period of time, putting public health issues as far behind their concerns of any industry in humankind. U.S. federal court, in a case brought by the United States government against the tobacco industry, found, and the quote is critically important, over the course of more than 50 years, the tobacco industry lied, misrepresented, and deceived the American public. about the devastating health effects of smoking and environmental tobacco smoke. They distorted the truth about low tar and light cigarettes so as to discourage smokers from quitting. And the piece that's not on there is, and they're still doing it today. Need evidence about the scope of this? Just quick juxtaposition. Wonderful quote from the head of Philip Morris, 1954, when the first scares came out, that says, if we had thought or had any knowledge that in any way we were selling a product harmful to consumers, we would stop business tomorrow. Fast forward to 1998, past the period of time where you had to be living in Antarctica not to know the data. The CEO of Philip Morris says in response to a question under oath, I don't know if anyone dies from smoking tobacco. I just don't know. That's why you need to understand that strong warning labels are as important today as they were in the 1960s. Not only did the court find that the tobacco industry had been lying, they found that it worked, that the constant challenges by the tobacco industry to the health effect, in fact, undermine people's knowledge of the health effects, appreciation of it. Not just the courts, but every major independent body that's looked at that. In the last 10 years, we've had the Surgeon General, the President's Cancer Panel, the National Cancer Institute, the Institute of Medicine, all found that our current warning labels don't work. No one reads them, no one remembers them, they don't have an impact on people who see them, that they simply worn out and have no impact whatsoever. So why does that matter? I mean, I started out by saying you had to live basically under a rock not to know that smoking causes disease. There's a big difference between knowing the statistics that says that smoking causes disease and appreciating the actual risk of it. And it's a vitally important distinction when you're trying to change human behavior. And that's what we're trying to do. Two quick examples. Although smokers generally understand that smoking can cause lung cancer, they dramatically underestimate the risk of increased risk of lung cancer. One study found that more than a quarter didn't believe that smoking increased the risk of getting cancer a lot. Think about it. Smoking 2 cigarettes a day doubles your risk of lung cancer. The average smoker increases the risk of lung cancer by about 20 times. In fact, lung cancer would disappear as a major public health issue in the United States if we didn't have cigarette smoking. Equally as important, there's a common denial among tobacco users, as well as people who take other risky behaviors. But in tobacco, it's particularly devastating. Even smokers who can answer all the questions right about the health effects of smoking, when you ask them about whether they are at increased risk, will tell you in very disturbing numbers, no, they don't. Somehow they believe that they're immune and everybody else is at risk. And if you don't have a warning label on there that reminds them every single time they pick up a pack of cigarettes, every time they light up, every time they're thinking about a purchase, what we find is that deniability will overwhelm rational decision making, particularly when you've got a tobacco industry spending all that time out there. There's another important reason. As we've curtailed on tobacco marketing, the package has become even more important for the tobacco industry as a marketing tool. Again, Philip Morris. Our final communication vehicle with our smoker is the pack itself. In the absence of any other marketing messages, our package is the sole communicator of our brand essence. We can get rid of all of the magazine advertising, all the billboard advertising. We've gotten rid of TV advertising. If the cigarette pack remains the allure that it is, then they've continued to have a way to send their message. I show you this slide because it's a perfect example. This legislation banned the use of the terms light, low tar, and mild because those terms have been used to deceive consumers for decades into believing that low tar cigarettes in fact reduce your risk of disease. They don't. So what did the tobacco industry do when this legislation banned the use of those terms? They rapidly color-coded their packages before the law went into effect to teach their consumers which cigarettes were the light ones, which were the ultralight ones, which were the mild ones, and to educate them so that by the time the terms came off, nobody needed to see them to be able to look at the pack and realize that a slightly lighter color pack was light, a much lighter color package was ultralight. You actually have an interesting phenomenon looking globally. You can see the exact color choices that the tobacco industry has made in country after country after country that has done this. After substantial testing to recognize that different colors connote different levels of mildness, different levels of safety. The tobacco industry would not let us and the government want to use that kind of thing to dissuade people from smoking, but they're doing it with the pack. So unless we change what that pack looks like, we shouldn't kid ourselves that we've eliminated the allure of tobacco industry marketing. That's the reason that this legislation takes away the authority of Congress over cigarette packs, gives it to the Food and Drug Administration, tells the Food and Drug Administration to immediately, and the FDA has done this, on June 22nd of this year they issued final regulations, which Joanna will talk about more, changing the cigarette warnings on the pack as Congress mandated, moving it from the side of the pack in text only to the top 50% of the front and back of the pack, 9 different labels, 9 different text warnings, mandatory pictures that depict the health effects of smoking to change what consumers see every time they use a cigarette, every time they're making a marketing decision, every time they're trying to figure out who's telling them the truth, tobacco industry or the government, about the health effects of smoking. If you put those different pieces all together, then these warning labels have the potential to have a very dramatic effect on public attitudes and public behavior about tobacco use. But the key to that is you need to put them together. They can't be swimming upstream against an industry that has sole control over the product, sole control over the marketing, sole control over what the American public hears. As part of this puzzle, these are a critical next step. Thank you.
Great. Well, good afternoon. It's my pleasure to be here as well. And Matt is always a hard act to follow, but I'll do my best. I think these public health practice sessions are set up so that you can hear both a practice and more of a research perspective. So my role here is to bring in some of the research behind regarding the topic, as well as provide you a bit of an international or global perspective on this issue as well. And just to say, in terms of practice, you could not have heard a presentation from anyone better than Matt Myers on this topic. I think if you have to name one person who's responsible for these, the picture warnings on the packs, it is Matt, and I think the whole country has a lot to thank him for, as well as the more comprehensive legislation. The title of the session is the FDA, or the new cigarette warning labels, and the subtitle is the FDA's bold move and its expected impact on public health. And maybe after, during the Q&A, we can talk about whether it is a bold move once you see what has been happening globally. I have a one slide on the modern history of warning labels. So this is how packs in this country look and how they looked globally up until 1994. And at that point, we had some innovation in health warnings, this new tombstone advertising, black text on white, or there was also white text on black at the top of the pack. I think it was 25-30% of the pack was covered. So this was an innovation in 1994, and this happened to be in Canada. And then in 2000, globally, we saw the first introduction of picture warnings, taking up 50% of the pack, top the top of the pack, front and back. There's actually more to this warning. It wasn't just picture warnings. There were special inserts as well in terms to give tips on quitting, etc. But 2000 is the year that picture warnings were first seen globally. And then in 2010, we have Uruguay introducing 80% of the front and back of packs having the health warnings. So just to put this in juxtaposition, look at the two packs and think about what Matt said about the pack being used to portray an image and to do their branding and advertising. And you can see that once you're covering the pack with a warning, there's less room to communicate image on the pack. And of course, for those of you who don't pick up tobacco packs regularly, this is what the current warning looks like on U.S. packs. So the front just looks like one of those packs I showed you from many years ago, if you think globally. And the warning, you can't find it, basically. It's on the side. Now, again, just in terms of a global picture, tobacco use is increasing globally, and the toll from the use of tobacco products is staggering. Currently, we have almost 6 million people dying from tobacco products each and every year. And if current trends continue, this is supposed to increase by 25%, up to about 8 million people dying a year from tobacco products. And you have to keep in mind, these are completely preventable deaths. There's no reason one person has to die from using tobacco products. That being said, there is some hope, and that's the Framework Convention on Tobacco Control, which is the world's first global health treaty. We have 174, I think, countries that have now ratified the convention. And countries that ratify the convention are required to implement evidence-based tobacco control policies and programs. And health warning labels are one of them. Article 11 deals with the package warnings, and these are the guidelines for countries who need to implement the FCTC. And let me just go through these. So the warning label should, and so this is not exactly shall, it's a should. They should appear on the front and back of packs. They should be at the top of the pack. They should be as large as possible, at least covering 50% of the pack, but not less than 30%. They should include full color pictures. There should be multiple messages, and they should be rotated. They should provide advice about smoking cessation, and there should be communication about the ingredients of tobacco products, but not with numbers, because we know now that those are misleading, and people can look at those numbers and think that one pack of cigarettes is less harmful than another. The World Health Organization earlier this year published its most recent report on the global tobacco epidemic, and this report focused on warning about the dangers of tobacco, and certainly health warnings were a big part of that. And I'm just going to show you one graph from that. It's very busy, but I'm going to highlight a few of these bars. Let's start here. So this shows the number of countries that require health warnings on their cigarette packs. So that's 130 countries. If you see the different colors of the bars, the lightest color are countries, low-income countries. The sort of middle blue is middle-income countries, and the darkest blue is high-income countries. So you see high, middle, and low-income countries that do require health warnings on packs. If we look here, this is the number of countries that require at least 30% of the pack to be covered by health warnings, 101 countries worldwide. And 30 countries currently require at least 50% of the pack to be covered. And when we're talking about picture warnings, 42 countries worldwide currently require a photograph or graphic as part of their warning labels. So when we talk about a bold new step in terms of warning labels in this country, you can certainly see there is lots of precedents globally for picture health warnings and large ones as well. So the big question is, are tobacco package warnings effective? I'm going to leave that question for a moment. We'll get back to it. But let me start by summarizing some of the findings that were in a recent review done by David Hammond, who's at the University of Waterloo in Canada, and probably the person who's done the most work on tobacco warning labels in the world from a scientific perspective. And he published a review on the health warning messages on tobacco products. And these were some of the bottom line findings. So basically he did it wasn't a meta-analysis, it was sort of a systematic review. The literature in this area is quite diverse. There's literature from communication theory, experimental studies, population-based studies. They're sort of hard to combine, but the findings are consistent. So we know now that warning labels can increase health knowledge, they can increase perceptions of risk, promote smoking cessation, and can also prevent smoking initiation among youth. We also know that warning labels are more effective when they are bigger, when they're on the front of the pack and also the top part of the pack, and when there are pictures included. So let me say a little bit about pictures. Pictures are useful and are effective because they can evoke emotional responses from the viewer. They're also more easily noticed and remembered than just text. They're essential when people don't have high literacy rates, and they were found to sustain their effects longer than simple text messages. The other advantages of health warnings generally on the pack is, first of all, that they have extensive reach. And Matt already mentioned this, but I think it's been estimated that a smoker who smokes a pack a day for a year will probably see the warning label around 7,000 times that year, because each time they take their cigarette from the pack, they're going to be seeing the warning label. So the reach is extensive. You can also communicate directly with your target audience. It's very effective to reach smokers as well as potential smokers. I've mentioned the frequency of exposure, and again, just to reiterate what Matt said, the package today is becoming the key marketing device of tobacco companies, as there's fewer marketing venues available to them. So by taking up the valuable real estate of the package, you're disrupting the marketing value of that pack. So these are just the sub-bullets, are that the pack itself can reinforce brand imagery, the pack can minimize perceptions of risk and fuel misperceptions that some cigarettes are less harmful than others. So by taking up space, you're addressing some of these issues. Couple things about fear appeals. This is actually a warning from Uruguay. So I think fear appeals, or scaring people, I guess, used to be in vogue and then sort of went out of vogue because people thought that if you're scaring people, they're going to tune out your message, and so they're not going to listen to you at all. But I think we sort of come full circle now, and the literature shows that fear appeals, or scary pictures in this case, can be effective if the appeal is strong, if it's legitimate and not exaggerated, and this is important, if it's accompanied by information on how the threat can be mitigated. So you have to give something for people to do once they're scared. And so, for example, when we're talking about health warnings, that would be giving information on how you can quit, where you can get help to quit. A little bit more on size, and some countries have had to deal with this. Do you put 50% of the warning, or use the front 50% of the pack for the warning and the back 50%, or do you do Do you try and get more of one side's on one face of the pack? So for example, Australia had 30% on the front face of the pack and 90% on the back face. And so the average there would be a 60% overall on the pack. And is that better than 50-50? It's not simple to study these things, but Ron Borland in Australia did an observational study where he went around restaurant cafes and looked at tables and how the cigarette packs were sitting on tables when smokers had them out on the table, and found that 90% of them had the front face up. Maybe that's because there was less warning, less of the warning on that side, probably, and also because that's how you open the pack. So it seems, I think, the best practice is to make sure to have as much of both sides as possible, and predominantly on the front face of the pack. So overall best practices from the literature. You want pictures and messages that elicit strong emotional responses. That's how people notice them, and that's how people remember them. You want to include information that will increase motivation and confidence in quitting. They have to be believable, and that includes the pictures are believable, and they have to be personally relevant. So keeping those in mind, you've already seen the warnings, but I'll go through them again briefly. Warning cigarettes are addictive. And you can think about the best practices and whether you think that these, how well these warnings meet current best practices. So warning, tobacco smoke can harm your children. Warning, cigarettes cause fatal lung disease. Warning, cigarettes cause cancer. Warning, cigarettes cause strokes and heart disease. Warning, smoking during pregnancy can harm your baby. Warning, smoking can kill you. Warning, tobacco smoke causes fatal lung disease in non-smokers. And warning, quitting smoking now greatly reduces serious risks to your health. So these are the warnings that we're going to see shortly, if all goes well, on packs in this country. But let me just juxtapose these with, I've already shown a couple of warnings from other countries, but let me show you a few more. This is one that is supposed to be coming out in Canada shortly. This is a real person, Barb Tarbox, who actually did die at age 42. She was a model, has a daughter, left a young daughter behind. And so it says, warning, this is what dying of lung cancer looks like. It says Barb Tarbox. So trying to get that realistic perspective. This is not a model. This is a real person. Died at age 42 of lung cancer caused by smoking. And then the positive message, you can quit, we can help. Here's the 1-800 number and a website. In terms of fear appeals, these are current warnings in Brazil, one on gangrene and the other on the effects of secondhand smoke on unborn babies. So if anyone says that the US warnings are graphic, now you've seen graphic. Mouth disease. Mouths are very popular because anything to do with the face, people react particularly strongly to, because the face is what everybody else sees. You can have awful things going on inside, but people see your face. So the mouth pictures are quite effective, and I know when these first came out in Canada, those were the packs that I remember being in a store and someone asking the clerk for a pack of cigarettes. They reached for one with the mouth warning, and they said, no, not that one, and got to ask for a different one. So we know that those are particularly effective. And then here, so that's one currently in Singapore, and then the blindness. This is an Australian ad warning. Okay, so are tobacco package warning labels effective? And I think you have to be careful about what effective means. Matt mentioned that there's no magic bullet, and I think by saying that a picture on a pack is going to battle an addictive disease is a little on the hopeful side. So let me start with a cartoon. This is a doctor talking to a patient and says, "Listen, when the side effects of this medication kick in, you'll forget what was wrong in the first place." So you can think of cigarettes as having tremendous side effects, clearly. And when you buy other legal drugs, pharmaceutical products, for example, there's a piece of paper inside the package that you can sort of unfold, and it tells you all of the side effects of what you're taking and what you should be looking for and when you should speak to your doctor. And so tobacco products are legal. They're extremely harmful, killing 1 in every 2 of long-term users. But there haven't been any effective warnings. And even, with our 9 messages, those are only 9 messages. There are a lot of other diseases caused by tobacco use. So I like to I think of tobacco package warning labels as a step towards informed consent. We're finally starting to educate users of the product about what the product can do for you, because there isn't one of those inserts in every pack. So if you think of it this way, that you're trying to start to educate users of the pack about the side effects of the product they're planning to use, then clearly the package warnings are extremely effective in increasing knowledge and perceptions of risk. And we also, as I've said, know that they do increase intentions to quit and actual quitting behavior. Some challenges moving forward. So let's fast forward a number of months. We've got our warning labels on packs here. There are a number of things that we still have to do. We can't rest easy, and this is always the same in tobacco control and probably other areas of public health as well. The battle never ends. So we need to set up a surveillance system to make sure that the letter and the spirit of the requirements are adhered to. We want to make sure that there is actual full rotation of the warnings as required. And we also want to, it would also be important to look at unintended consequences. So, for example, what happened in other countries that required picture warnings is that the industry came out with packages that made it very hard to see the warning, okay? Because the warnings were designed for packages of a different size and shape. So once you start, and this is just one example of it, there are 20 cigarettes in here. But they also have these interesting sort of octagonal package designs. So what is the front face? Is it just that first sort of face? Is it the sides too? So I think it's very important that we start monitoring, seeing what's happening in package design once the warnings are introduced. The other key thing that we have to remember is that even before the warnings come out, we have to continue to plan the next set of warnings. It's very important to be refreshing the warnings on a regular basis. This is very hard for governments to do. Some have done it well, most have not. But of course, there's going to be message wear out and picture wear out. So it's a challenge. It's not easy, but the FDA is going to have to try and work towards the next round of warnings to minimize this wear out. So just 2 more slides before I end. So this was the one slide modern history of warning labels, and then I want to show you one slide on the future of tobacco packs. And this is what we're going to be seeing in Australia not too long. This is a plain and standardized pack. So the picture warning, as you can see, is taking up, I think, 80% of the front and back face of the pack. The packs will be a standard sort of, well, we'll see what, like a fecal brown sort of color, the part that doesn't have the warning, and then the brand name will be in standard font. So whether it's Marlboro or Cool or Salem, it won't be in a special type font. So we're going to see this in Australia shortly, and not only is the pack going to be, are we going to have the warning and the sort of sort of standardized font, but the pack size and design is going to be the same as well, so that the companies can't play around with new innovations in the pack to get to create more excitement over the product. And there has also been talk, and I'm not sure if Australia is doing this, maybe Matt can answer this during the Q&A, but of also standardized cigarettes. Because again, I mean, if you can fit 20 cigarettes in this pack, the companies can play around with length, diameter, what they print on the cigarette. Once you pull out a cigarette, there are lots of variations in the paper, the design on the filter, et cetera. So working also towards standardized cigarettes. So the future is bold when you look globally. We have the FDA, as mandated by Congress, has taken a very important step. We're finally catching up with the rest of the world. It's an important step, and it will play an important part in reducing tobacco use in this country. So thank you.
Thank you very much, Matt and Joanna. This is now the Q&A portion of our session. So I invite our two presenters to come join me on stage. Let me make sure that your mics are on. Also invite all of those who are watching online to please, you can also send in your emailed questions to our presenters by simply clicking on the link on your webpage. So with that, do we have any questions here in our live audience? Yes, right in the back. And if you could just wait till we can get the mic to you so that people watching online can hear your question as well. Thank you.
Hi, thank you for a wonderful presentation. And I work for state government in India. And finally, we were also come out with the labels before 2 years. But unfortunately, we are not able to rotate it. And that battle is going on. One question, like we have this 9 warnings. Is there a specific guideline which one the company will go or any proportion? Because what happened in India, like we had 2 warnings. And everybody ended up with a warning which is not clear to convey, like X-ray chest. So are there something proposed in the...
It's a great question, particularly because India's been fighting about warning labels for some years. And unfortunately, the regulation in India does not specify how they get rotated. As a result, the tobacco companies in India have routinely just put the weakest warning label on the package that's most widely distributed. In the United States, the tobacco companies are required to provide the FDA with a plan that lays out how they'll be rotated so that it's random, so that the companies can't manipulate how many times each one appears. They must appear equal number of times with no control by the companies over where they will appear, so that a consumer will see them on a regular basis without that problem. It's a vitally important thing. And as you look around the world, too few countries have paid enough attention to that issue. There's strong models for how we can ensure that the companies don't manipulate what it is. Otherwise, what we found in some countries is the warning label on pregnancy, for example. They only sell in places where only men buy cigarettes. The warning label on impotency, which we've seen, they somehow only put on women's cigarettes. So it is critically important when you're doing this to ensure that the companies don't have any control over that manipulation.
Okay, yeah.
The FDA is about to embark on a public education campaigns to back up the legislation. And by the time some of those campaigns get off the ground, it's going to be an election year. To what extent do you think it's possible that some of the good work that has been put in will be mitigated by the fact that it is an election year? That's question number one. The second is that the last time we had a public education campaign was sort of post-settlement, and we had things like the Legacy Truth campaign, very cutting-edge work. The communications landscape has since changed dramatically with the rise of social media. What do you think, from a public education standpoint, are some of the key tactics and approaches that need to be undertaken to make sure that these kind of messages are widespread?
Two great questions. One of the reasons for giving the Food and Drug Administration the breadth of authority and the flexibility of authority that the legislation does is to try to take as much of tobacco control policy out of the hands of politicians and out of the hands of the vagaries of every election. Having said that, no agency, no matter how independent, is immune from what public sentiment in the election cycle is like. Our hope is that as FDA begins to use mass media to complement and help them make sure that their regulatory actions have the maximum effect, that it'll be done based entirely on science, and that the administration will allow them to go forward. It's one of the reasons why I think the role of all of us as public health leaders really never ends. It's our job to ensure both that the Food and Drug Administration keeps its eye on the science of the best way to do these things, and that we build public support for those actions. Graphic warning labels will succeed only if the American public accepts them, if there is leadership provided for them, and so I think it's a critical role that we all have to play. Second, and I'll defer to Joanne somewhat on the question of how best to do the mass media, there's a great deal of literature that has grown up about what's effective. The key to having both the Food and Drug Administration and the CDC has announced that it's going to do mass media campaigns is to ensure that they're doing what the science tells us works best and is most effective, and that we in the public health community are providing them the protection and support to ensure that they can do it, and that political leaders who often don't pay attention to these sorts of things are educated about it in advance, so that when they do what the science tells them to do, they have the political support to ensure that it has the public health impact. No mass media campaign will have the desired goal unless it's sustained over time. The Food and Drug Administration has the funding to complement its regulatory authority with targeted campaigns if it so chooses. Our hope is that they will.
Great, and the only thing that I'll add is there are some great examples globally of best practice of linking public education campaigns with the graphic warnings that are actually on the pack, and that helps reinforce the messages. So Australia, for example, has done an excellent job. The pack warning, you see it on the TV ad. You also see the materials coming through also like in information in doctors' offices. So it's really reinforced messages, and I think, again, there are models that we can look to.
Okay. We do have a few questions from our online audience, so I'm going to get to a couple of those first. There is someone who teaches an adolescent tobacco education class, and some of them are already looking forward to collecting the graphic labels. Do you have any comment or research about how the graphic warning labels impact teen tobacco use?
Well, the literature there's no one magic bullet. Smoking is a human behavior, and all human behavior is complex. But we can do what we can to reduce the attractiveness of tobacco use and the social acceptability of tobacco use so that people can make the right and healthy decisions. So the research that we have shows, even among teens, that the package warnings do increase knowledge as well as intentions to quit, and that folks are less likely to want to start to smoke as well. So that's where the research is. We can certainly use more. So if anyone is interested in the research side of this, please contact me, and there'll be lots of new work that we will be able to do.
I think there's good reason to expect that it will be particularly effective with youth, because youth who are deciding whether or not to smoke make that decision in no small part based upon vision of themselves, the imagery projected by the product. If this product helps them make them look sexy, make them look cool, make them look independent, all the things that an adolescent wants to be but doesn't quite think that he or she is, then they're far more likely to smoke. That's what tobacco industry marketing and packaging is designed to do. The extent to which these package warnings cut through that and make it impossible for the industry to present that false image, the ability of all of the other efforts that people make to try to discourage youth tobacco use are likely to be far more effective. And the data that we've got seems to indicate that is the case. I think it's one of the reasons why the tobacco industry fights these labels so hard all over the world.
And actually, I'll just mention in terms of the importance of the label and taking away the brand imagery of the pack. So what you can expect once the warning labels start appearing on shelves is that there'll be a lot of media stories about new covers that are for sale that people are using to cover up the packages, and there'll be a lot of excitement around that, and a lot of sort of discourse around, well, the warnings aren't going to be effective, and people are just covering them up. This has happened in every country. It'll happen here. It's a few weeks, and then everything will subside again. So you can expect to see that, and it is a sign that these are effective. People don't want to see them, but in the end, people don't go through the hassle of covering up the warnings.
Speaking of which, Matt, you mentioned the lawsuits against the implementation of this law. Can you give us any update on the tobacco industry's attempts to prevent the implementation of the warning labels?
Sure. Probably is a sign, not just in this country, but in every country that has really worked hard to do effective warning labels, the tobacco industry sues. The themes change from country to country. In the United States, the tobacco industry filed suit several months after the law was first enacted in Kentucky, challenging the constitutionality of requiring pictures even before they knew what the pictures would be. Fortunately, the judge in Kentucky found that given the magnitude of the harm, the industry's behavior, that the warning label requirement was constitutional, was consistent with the First Amendment. That case is now on appeal. After the pictures came out, they filed a second lawsuit looking for a judge who might be more favorable in the District of Columbia. And that, again, basic argument is that they can't be compelled to tell consumers something that they don't want to tell them, i.e. that our product causes all these horrendous problems. That case is still pending, and so we don't know the result of it. The FDA is fighting it hard. We and a whole host of other public health groups have weighed in with our opinion. But you should understand this is standard practice. When Uruguay increased the size of its warning labels to 80%, Philip Morris International sued them under a bilateral trade agreement in a World Bank arbitration proceeding. When Australia announced that it was going to do this plain paper packaging, Philip Morris announced that it was going to sue them again in the World Bank in the same kind of proceeding. I had actually hoped that today we were going to be able to come in and tell you the exciting news that this morning Australia passed the plain paper packaging, because this morning they were debating it. Unfortunately, opposition succeeded in delaying it, so it'll probably be 2 more weeks or so before it actually passes there. So what we've seen is that everywhere strong labels have been enacted, the tobacco industry has fought back. And I think if we need any single indication that they're as effective as we think they are, I think the vociferousness with which the industry has fought them is a clear sign of their impact.
Okay. I know we have more questions here, so yeah, go ahead.
Okay. I think this kind of ties, I guess, nicely to what you just said, because I'm from Kentucky, and I guess I can see not only the political side of it and how politicians can be really steeped into the politics of it, but also how states can be culturally and economically really dependent on tobacco. And first, I guess I should have said this from the beginning, but thank you both for not only your presentation, but also for your work to help make us healthier, kind of despite ourselves. But that being said, you mentioned in your presentation how there was a form of a bill that incorporated alternative uses for tobacco as far as agriculturally and that kind of thing. And I wanted to ask if you could elaborate on that and if that was included in this comprehensive bill. And second, what about like behavioral interventions and those kinds of things, if you guys could speak to that. And lastly, does the comprehensive bill, does it cover anything outside of cigarettes as far as like contents and knowing, full disclosure on like chewing tobacco, et cetera, et cetera? And
why don't I answer questions 1 and 3, and I'll let Joanna answer the behavioral question. First of all, the bill, all of the provisions of the bill automatically apply to all smokeless tobacco products, so they apply to chewing tobacco. And they give the FDA the authority to assert jurisdiction over all other tobacco products, which FDA has announced they plan to do. So that by the time it's finished, FDA should have authority over the full range of tobacco products. The issue with regard to the tobacco growers is an interesting one, probably one of the more interesting experiences I've had co-chairing a committee with the president of the Burley Tobacco Growers Association from Kentucky. And ironically, as you look at this polarized society, he and I became really very close friends as a result of it. The report that we got broad consensus on wasn't designed to create alternative crops for tobacco growers. What it did do was provide a mechanism for tobacco growers who want to get out of the business of growing tobacco, a mechanism for doing so. Recognizing that there was no way this commission could come up with alternative crops. The agricultural economists on the commission properly recognized that for societies like those that exist in Kentucky, what you need is an amalgam of both agriculture but non-agricultural mechanisms to make a shift in the economy. So one of the things I'm delighted to report is in no small part as a result of legislation that was enacted in 2004 that adopted some of the agricultural provisions in that. Today we have less than half the number of tobacco growers in this country that we had when the commission first met. And there are many fewer families in the United States who are now dependent upon tobacco growing as their primary means. It's no longer even the #1 cash crop in Virginia, for example. And I don't think it's a coincidence that we've seen some progress in tobacco growing states as a result of that. At the same time, the tobacco growers became some of the strongest proponents, because when you sat down with them, they didn't want their kids to smoke any more than we want our kids to smoke. And one of my favorite stories is a senator from South Carolina coming up to me one day and saying that he had just been visited by the South Carolina Tobacco Growers Association, who showed them a series of Camel ads that they were outraged about. And I never thought I would hear that, but I think what we see is when we can engage growers around the world, they have legitimate, fair economic interests about how they're taking care of their family, and we need to address those. And when we address those in a fair and reasonable way, they're not the opponents of public health. It's often the manufacturers manipulating politicians who are the real opponents there. So, in Kentucky we have a smoke-free Louisville, a smoke-free Lexington. It's still a very hard battle there, but I think we've seen real change.
Sure, I'll add a little bit to that, maybe from a bit of a global perspective. So the Framework Convention on Tobacco Control also addresses alternative livelihoods. It's a really challenging issue, and we have a lot to think through about how best to do that. But one of the things to keep in mind is that the actual farmers, people cultivating the crops, are not well off. They're not the ones making the money. That's how they have to live. They don't have many other choices. Often their children are involved in cultivation as well. And we know from some work right here at Hopkins that there's symptoms of green tobacco sickness even among kids working in the fields. So they're not the ones making the money. I think they understand the issues. It's just what are the realistic alternatives, and I don't think public health has had a lot of experience in this, so we have learning to do and partnerships to make and some challenges in figuring out the best way to move forward on that. Also just mention the issue of other tobacco products. So we are going to be getting warnings on other tobacco products, but other tobacco products other than cigarettes. But it's even, I think, even more of a challenge for regulators because the other products come in such different packaging and sizes and tins and so really, we can't underestimate the challenge that regulators have to actually design the label that will fit on all these types of packaging and be visible and effective. And in terms of behavioral intervention, I think you're referring to smoking cessation, and you can talk about the act here, but I think generally and globally this is the case as well with the Framework Convention. I mean, cessation, offering help, providing cessation resources is certainly a component of the comprehensive strategy. But I think we've sort of focused much more on the environmental components because you can help people quit one at a time, but if the overall environment supports tobacco use, so if you see tobacco products wherever you go in your daily life, when you go to the grocery store to get your bread and the gas station to get your gas, and you see it behind the cash, all those packs, and if you have cheap tobacco products, and if the social norms support tobacco use, if there's smoking in public places, you can try and get one person to quit after another, but the environment is not supportive of keeping people smoke-free. So I think a lot of these interventions have tried to focus on creating the environment that will stop the flow of new tobacco users into the market and will help increase the flow of current tobacco users out of the market.
There's some population-based things we can do as well on that. The legislation mandates FDA to take a look at how it's been treating drug products that help people quit smoking and to see if there's a mechanism to fast track and encourage the development of new and more effective ones. At the same time, the new warning labels do include the 1-800-QUIT-NOW line, and a number of our organizations have been working to ensure that the federal government fully and adequately funds quit lines to assist tobacco users who want to quit, so that at the same time we're creating the demand for quitting, we're making sure that the services are available to them. The third component of that a number of us have worked on is in the Affordable Care Act, Obamacare to those who don't like it, healthcare reform to everybody else. There are provisions for expanded insurance coverage for people in Medicaid, Medicare, and hopefully in the basic insurance package for smoking cessation. Smoking cessation shouldn't be treated as a tobacco control issue. It should be treated as helping people deal with a medical problem and covered by the traditional insurance system. So a number of us are working on that as well. In low and middle income countries, it's a much more challenging question. India, for example, has less than 2% of smokers have ever tried to quit. And obviously cessation services in India are scarce. The Indian government is trying to deal with the issue, for example. But when you look at with limited amounts of money and you want to impact the most people, you need to be careful to get the balance right with regard to it. So we need to provide additional services. We need to provide better assistance. But at the same time, given the magnitude of the problem, I think we have to keep our eyes on population-based solutions.
Okay. I think we have time for just one more quick question. So.
Regarding the plain packaging in Australia, one of the arguments that the industry used against that was that it would mean that the only differentiating factor between any brands would then be price, and I was wondering what your thoughts were on that.
And so what's wrong with that? I mean, let's come back to what's the role of packaging. The role of packaging helps create an image. It creates an image for young people that fits their model, whether it's sexiness, whether it's independence, whether it's being in the cool crowd. That will get eliminated over a period of time. For people who are thinking about quitting, we've seen them use the package to alleviate their concerns about the health effects of tobacco use. We've seen them use the package to direct them to products that they falsely believe are less hazardous than the product that they're currently using. So when we eliminate all of those things and we say to them, now go pick your cigarette based on which one tastes better, rather than all of these other false things, I think what we will see is just a dramatic drop in all of the tools the industry uses to get people to start and to prevent them from quitting altogether, which makes all of the other things that we in public health do much, much easier. You know, I've often talked to people who say, what role of government has in this? And think about, if you're a mother and father sitting down at your kitchen table trying to convince your teenage son or daughter to quit smoking, it would be a fair playing field if you didn't have to go up against the Marlboro Man. That's what plain packaging will help us do.
Okay. I really want to thank so much Mr. Myers and Dr. Cohen. And thank you all for coming, and we hope to see you next month.